Hello, hi, good evening, all. Can you all hear me?
Yes, ma'am.
Okay, perfect. Okay, thank you. Uh, can you see the slides as well?
Yes, ma'am.
Okay. So today, I'm Dr. Geetmala. I'm one of the pediatricians. I was working in UK for few years before moving back to India. So today, the plan for the session would be to do few communication stations. I would aim to do at least 2 or 3 communication stations. I know this is going to be a mixed group. Like some of you might already be preparing for the exams. Some of you might be completely new. So for the benefit of both, I'm going to start basics about what is communication, what would be expected for very few minutes. Like I'm not going to drag it for long. And then after that, we'll do some templates. Like I'll show you how we generally do a communication station. You can use that template, or if you have your own templates as well, you can follow as far as you cover all the points. It's well and good. And then we'll try and see if I can ask a couple of you to participate in a practice mock session if anybody is interested. Uh, is it 9 o'clock already? Yes. So among the people who have joined, if any of you are interested in doing mock, please put down your name in the chat. So I'll take whoever's will post for the first. So the first two person will get a chance to do the mock. Okay. Okay. So coming to communication stations. So as you all are aware, MRCPCH clinical stations actually has total 10 stations, out of which 2 are communication stations. So this is the circuit. As you start preparing, you'll get to familiarize yourself with this circuit. If you want to know exactly what is MRCPCH clinical examination, what is the circuit, what will be happening during the exams, it would be ideal for you to actually visit the RCPCH site, go into the clinical exams, and you'll find all these details. So this is nothing made by us. This is all taken from the RCPCH site. So you'll find this. So it is like this. You'll have 10 stations, 4 clinical stations, 1 development history. So these 2 are long stations. And you have 2 communication, 2 video stations. So that would be the order. But as it says, so there are 10 stations. So 10 people will be standing, 1 in each station. So your first station can be clinical station 1, or your first station you can start anywhere in this 10 station. Even this might be your first station, video station. So if video is your first station, then you will move on along the circuit. This is the circuit. So you'll do all the 4 clinical stations together and then come to development history. It would be like that. But you can start at any point. You will be made to start at any point depending upon your roll number. So as we can see here today, we are going to try and do few communication stations. You have 2 communication stations, and each of these station will last for 9 minutes. This 9 minutes is inside the station. So outside you have a candidate information leaflet, and you'll be given 3 to 4 minutes to go through the information leaflet. And once the bell rings, you'll be invited inside to start your communication station, and then you can start your communication station. For communication station, this is the only station where all the 9 minutes will be with only the role player. So the examiner will just be observing you on how you communicate. You have no word with the examiner. It's only the role player. So you'll have a warning bell at 6 minutes time. That would give you a kind of clue that you have 3 minutes left. So whenever the warning bell rings, it means you have completed 6 minutes into the station. You have remaining 3 minutes. At this point, you should get ready to actually summarize and put down your thoughts and finally summarize and see what you can do. It is almost time to finish your station. So as you keep, initially it will take time. So to talk a topic, it might take a longer time. Like you might feel like you want 12 minutes or 13 minutes to do a communication station. That is how you all of us start. But as you keep practicing, your flow will be better, and you will understand it is not necessary that you will have to give every point related to the topic, but you'll have to give which is very much relevant to that station you should be talking, rather than talking too much about any topic. So that is what is expected. You should be concise, and it should be relevant to the person who's listening to the role player, and they should be able to understand, and also it should be a two-way communication. So you should understand their verbal, non-verbal communication, and also when you answer that, the station looks even more beautiful, and you can actually get very good marks. Actually, communication, if you practice and if you understand the station, this is one of the potential station where you can score the full marks. For anybody who has good communication skill, you should be able to score good marks. So all you will have to practice is your communication skills here. And then this is how your mark sheet is going to look like, which will be provided even before your exam starts. So you'll be given it in order of your appearance to each station. So if you start from station 7, this will be your first paper, and then goes 8, 9, 10, and 1, 2, 3, 4. So you'll have to arrange all those before the exams, and then you'll be given time to fill all these details even before the exams start. Ideally, that is how they do, or still you will have time outside where you'll be waiting for 3 to 4 minutes reading the candidate information leaflet. You can also fill in that time. And in communication stations, they will mark you against these 4 domains. So each domain will carry 2 marks. So total marks would be 8 marks for communication stations. So this is how the mark sheet for the examiner will look like. And these are the 3 criterias, like whether you meet the standards, you're borderline or below standards. So if it is below standards, it's 0, borderline 1, and meets standards, you get 2 marks. So yeah, that is pretty much how you will be evaluated, and based on depending on the domain. So what they will be assessing you when you do a communication station is that, so here uh, 90% of the time in two communication, one of them will definitely be an information giving scenario where you will have to talk about a particular disease or the pathophysiology or about a treatment. It is more like an information giving. The other scenario can sometimes be difficult, like a difficult conversation, breaking bad news, taking a consent, critical incidents. All those stations might come as another station. However, there is 90-95% chance that you'll definitely get an information sharing station. So in this, what will be assessed in communication is that they will look into how you're sharing the information and how accurate is the information. So you can still share information, but you should make sure you understand what the information is and if the information is right. So accuracy is also equally important, rather than just trying to fill up the space. It is essential you talk what you know. If you don't know, you'll have to say politely that probably I'm not sure about this right now. I can look into it and I'll come back. So accuracy of information is equally important. And then your rapport and communication style. Rapport means it should be kind of, you should be able to uh, build a good rapport with the role player. So they should be in a position and be able to listen to you, rather than sometimes what happens is in an exam rush, they would be concerned about one particular thing. They will ask you about it, but sometimes we do ignore that question and talk about the topic that was given in the candidate information leaflet. That is not the right thing to do. So you should build a rapport. If they have some concerns, gently answer them. And there are ways that you can cut short the conversation. If you think the role player is talking too much, there are potential good ways, gentle ways of trying to cut short some of the conversation. But however, you should not abruptly avoid. Kindly mute all your mics, please. So that is your rapport and the communication style. Next is verbal and listening communication skills. So verbal and communication skills, like how you're able to listen and answer to their queries. And finally, this is also an important step. You should try and cover this at least when you summarize. So what is it's about managing concerns. If the role player has a specific concern, you should be able to address it, tell them what is the management or what is the plan for their particular concern, and also you should tell them what would be the immediate next steps that will happen. So these are the four important domains that you will be marked against in communication stations. So the say I have told it in a superficial way. However, this is present in the RCPCH site where you can look into what exactly they mean by each domain. So how they mark you against each domain and what is expected. So, and then coming to communication station, as I said, this is from the RCPCH site where it says outside you are usually given 4 minutes. And then inside you have 9 minutes. You have 3 minutes. The helper will give you a bell when 3 minutes is remaining, and then the station will end. So, and also here in the site, it would say what exactly means by meeting standards borderline and below standards. So it is all fixed, and it all has templates. They So if you do it in a right way, you will be able to meet the standards.
ना काम नहीं करेगी बिल्कुल भी
But if you're not sure, so if there is no adequate preparation, then it is possible that you might fall in trap with the role player, because they sometimes ask questions to divert us as well. Okay, so that is basics about communication station, what can be expected, what will happen in your exams. And coming on to proper communication stations, so there are a few varieties of communication stations. As I said, information giving. This could be about a medical condition or about a treatment that you might be asked to talk about. So that is an information giving scenario that will appear in most of the exams. At least one of them will be an information giving scenario. And the other thing is, this is also a kind of information giving education where you will be asked to talk about a topic like an audit cycle, a QI project, how is a guideline made to your own colleague, or sometimes it could be an education to a patient where he has had anaphylaxis previously, and you will be asked to teach about the EpiPen, or for an asthma patient you might be asked to teach about the inhalers. And then sometimes initially when you start preparing, you will feel like this breaking bad news, ethical scenarios and critical incidents are quite tricky and difficult, only until you learn what is the trick to break these stations. Otherwise, those are also simple stations, but initially while you start preparing, these are some of the difficult stations. So you'll have to learn few templates. There are lots of templates available online and otherwise as well, and how you can make your communication skills beautiful, like how you can say when you're sorry. Sometimes we just keep on repeating saying I'm sorry, I'm sorry, I'm sorry every line, at least 10 times the same words. Never do that. Don't repeat the phrases again and again. There are many beautiful phrases that can be shared to you in the group while you keep practicing. So that keep on practicing. So keep practicing these sentences from the beginning. Even sometimes it might feel like it is very artificial, but you'll have to try and inculcate that into your communication practice. RCPCH communication, it's more about being patient friendly, how good and gentle you are about communication, and how good you can build a rapport. So you'll have to have these criterias satisfied for you to get a good marks in communication. So as we told, there is information giving station, education. We have seen that, and then breaking bad news. This can be anything from a new diagnosis like a cancer diagnosis, or sometimes it can even be like a brainstem death, ambiguous genitalia. So any new information, if it is quite severe, it becomes a breaking bad news, like something that the role player has not expected, that becomes a breaking bad news. Even information giving can sometimes have a bit of breaking bad news depending upon what information you're going to talk about. And then it's the consent station. There are specific ways of doing each of these stations, but today we will be concentrating on information giving. So I will share with you template on how You can use this template generally for any type of communication, but however, this is more relevant for information giving. There are few changes that will happen with the template as we see the other topics. So today we will concentrate on information giving. Then you have something called as critical incidents. This is basically the medical error, could be a drug error, a prescription error, or a wrong breast milk given to somebody else, or some medical error that has happened. So you'll have to know what are the protocols that is done in UK regarding this critical incidents. What is the duty of candor? So that is about this topic. And then you have many ethical scenarios. So once you understand the concepts of ethical scenarios, that will be easy as well. Like it could be a non-accidental injury, or a teenager with anorexia nervosa or doesn't want to get admitted, or there can be something sometimes like talking about withholding care, withdrawing care, withholding information, Jehovah's Witness. So all those things will come under the ethical scenarios. Next is a difficult conversation. As said, any of these conversation can become difficult depending upon the mood of the role player. So sometimes it might be because of the critical incidents, medical error, that there is a difficult conversation, or sometimes there is a misinterpretation by the role player, I mean the patient, saying that the treatment that has happened is wrong or something like that. So all those will become a difficult conversation where you will have to uh, juggle between what was the management issue or the treatment issue that had actually happened with the patient, and then go along that line. So these are some of the types of communication which we usually see in MRCPCH exams. So coming to the template, this is the main template. So I keep the template same as much as possible so that it gets into everybody's mind. Repeatedly seeing the same template will help you retain the information. So that is the whole idea of why this template is made. There will be some changes here and there depending upon what type of station we are going to do. So as I said, today will be information giving. So when you uh, come for a communication station, as I said, there is 4 minutes outside, and there is a candidate information leaflet. So in communication stations, some of the leaflets are quite long. They have a large amount of information in this candidate information leaflet. What is essential is you will have to, and also you will be given a paper and a pen that you'll have with you. So please make note of the patient's name. Sometimes we get inside and we utter names which is not their true name, which is not in the information leaflet. We just say some random name because it might be the role player's name in the previous station. So never do that. That will start in a bad way. So always make sure you have written down the name from the candidate information leaflet in the 4 minutes when you wait outside. Write down the patient's name, write down the parent's name if it is given, and then minimal information. Try to read the information leaflet as much as possible. You'll have many background information. Make use of those background information, because sometimes you might have to bring that into your conversation to justify why you're saying this. For example, some error might have occurred, and then you will get to know the background of the child and what was the circumstance in which the error had happened. And also it will say now that the child is stable or not. So all these are important when you talk the communication. But if you are not sure about the background information, then it is going to sound little haphazard. And also, the other important key thing about communication is you are not supposed to make your own scenarios. For example, you might be thinking this is the right thing to do, this should have happened, and this has happened, while in reality, nothing about it is mentioned in the candidate information leaflet. So all the information which is present in the candidate information leaflet is the only information you will have about the patient. You should not create your own information. Try to say, if you don't know if the patient is stable or so, you're going for a consent, but you talk something about the child which is not mentioned in the candidate information leaflet, that is giving a wrong information. So that is an inaccurate information. So please read the candidate information leaflet as much as possible. Retain the information there. If not, write down in hints what is available. That is a very, very important point to note. and also read the question properly. At the end of the leaflet, it is usually there is a column called task. In that, after giving you so much background information, they will tell you what exactly they are expecting from you, whether this is a child who was admitted for headache, had fever, rashes, and everything. You think the child might be having meningitis, started on antibiotics, and all those things. And finally, they might write that kindly take consent for lumbar puncture. So, your task here is not to talk about meningitis. Your task is to go and get consent. Make sure that the role player understands that this child is needing this procedure, but you'll have to explain why exactly this child is needing the procedure, telling them the indication, what would be the side effects, complication, all those things. So that is how you should talk. Sometimes we just get carried away by the topic and start talking more about meningitis rather than about taking consent for lumbar puncture. So stick to your task. Stick to your task. Go and tell them straightly why you are here and what you're going to do. So that will kind of give you more time to concentrate on your bits of what they are expecting. Okay, so coming to template, when you go inside, first most important thing for you to do when you want to talk to anybody, even generally in a normal life, you'll have to go introduce yourself, tell your name, who you are, where do you stand in the patient's care, and then you start the conversation. So you go inside, tell that you are so and so, and then you are a pediatric register or whatever role is mentioned in the candidate information leaflet. You can use that role to introduce yourself. So that is an important step. So once you have introduced, then you're going to prepare for the interview. That means what you're going to do, you're going to talk to some person, but you'll have to make sure that is the right person you're talking to. So confirm the patient, ask them. Most of the time, because this is pediatrics, you have the parents there. You can say, am I talking to Mrs. So and so, mother of the child's name, if both are given in the candidate information leaflet. So it is important that you also confirm that you're talking to the right person. Sometimes when you're giving some information, you don't want any interruptions at all. There are certain situations like breaking bad news, talking about new diagnosis and all those things. You don't want any interruptions. What happens is, in UK, people carry bleep. Even here, I think we all carry phones where you get calls about patients. So when you carry bleep, there is going to be interruption if there is going to be a patient. So you'll have to make sure that you can sometimes say, like, for the next few minutes, I'm going to be completely with you. I make sure there is not going to be any interruptions. I'm handing over my bleep to my colleague, and I have come. So you can talk like that, making sure there is no interruptions. So you introduce yourself, confirm the patient, make sure there is no interruption from your side. And then before you start talking about the information, you can also ask if they want anybody else to attend. This is especially very important when it comes to breaking bad news, because they might want somebody else to be present as well. So that is how you prepare. So you are there, the role player is there. Ask them if they want anybody else to be attending from their side, and you make sure there is no interruption from your side. So that is all about preparation of the interview. So once you have set up the scene, then you will introduce the task. So this is exactly what I said. So there will be a task at the end of the candidate information leaflet. So you will be doing that task. So, for example, as we were talking about consent, you can go and say that I'm here to take a consent for a procedure. You start like that, then it becomes easier rather than saying, as you know, your son had so and so, he had meningitis, we suspect it could be, and I'm here. And if you start like that, the topic will get deviated to the disease, not to the procedure. So, go introduce straight away why you're here. But if it is a breaking bad news, don't go and straight away say the child is brain dead. Say that you have some bad news, or the news is something which you might not have expected. Sorry, I wish I had a better news. So you can use those phrases like that, just to give them a shot, saying that the news which is going to follow is not going to be a very good news. So that is like giving a shot before giving them a shock. So that is also important in breaking bad news. Otherwise, in general, straightforward cases, you can go there and tell them what exactly you are here for. That is called introduction of task. So now that you have introduced the task, the next thing, important thing is called recap. What is important in communication is you will have to understand what the role player wants to know, and there might be few information that role player already knows, so you need to know their background so you can check, do you understand why this child is going to need so and so procedure. Then the patient might say yes or no. If they say no, then you can say, as you know, like John was admitted with headache, high grade fever. We suspect he can have brain fever. And we want to confirm. That is why we are going to do this lumbar puncture. So that is why it is very important to understand the background. So once you introduce the task, you will have to ask how much do you know about it, or how much has been updated to you about the patient's condition. And then when you're giving information, sometimes the information is voluminous. So much of information might be there. So for example, if you are asked to teach a person about an ECG, just imagine how much of topics and information will be there when you talk about ECG. But your aim is not to completely talk about ECG fully, so that by the end of 9 minutes they will understand everything about ECG. No, that is not your aim. Your aim is to talk about at least one or two topics within the ECG so that it is spoken clearly, legibly, and they are able to reciprocate. So they're able to listen and then retain and also reciprocate what you have taught. So that is important. So, and when we talk continuously, some people might understand, some people might not understand. So you should also let them know that feel free to stop me at any point if you think it is difficult to understand, or if I'm not making any sense. I'm here to explain you as much as possible. Don't be in a rush to give so many informations. So that is called invite to interrupt. So you introduce the task, understand their background, how much they know about what you're going to talk, and then also let them interrupt you if they don't understand. So that is called inviting to interrupt. So you have so much things to do when you're setting up for interview. And then comes the main part. This is the delivery of information. So, as I said, some of the information are quite voluminous. Are you expected to talk about everything rushing through in 9 minutes? No, exactly. Definitely not. Nobody is expected to do a full topic lecture in a communication station. What you can do is when the information is too much, you can break them into chunks. So different topics you can, for example, if it is a consent taking station, you can talk about what are the indications, what are the complications, what is the outcome you are expecting, why is it important, and all those things. So you can break down into different topics and then talk about it. So that is called chunk and check. So when you break it down into chunk, you talk about one chunk and then check with them to see if they have already understood what you have spoken about. If they have understood, then move to the next chunk. See how much of these chunks you will be able to manage in your given time. Another important thing in delivery of information is illustrating. So sometimes, for example, if you will have to explain about certain anatomical deformities, or if you're going to talk about something like a PDA, coarctation, or urinary tract abnormalities, the best thing for you to do for the other person to understand is illustrate. You can draw. Yes, Taiba. In recap, can we ask what they know about the child's condition up until now? Yes, yes, that is exactly what the recap means. So that is knowing the background as well. So in each station, the recap is going to be different. So as we see different types of station, you will understand what type of questions you can ask for understanding their background. So for consent, you can ask them, why do you understand why this procedure is needed? That is an indication. Or you can ask them how much you are updated about that person's condition. So you what you said was right. So you can ask them that question. So coming to delivery of information. So what is important is illustrating is also equally important. So for example, especially the structural abnormalities or something, when keep in mind that you're going to talk to a role player. He can be a doctor, he can be a non-medical person, but in real life, it is actually some parent who might or might not have medical background. So your explanation should be in such a way that even a layman is able to understand. Okay, so for to make them understand, rather than talking about in left side there is a bigger vessel where there is a good which contains the good blood, right side contains the bad blood and all those things, it would make sense for you to actually draw and tell them what is actually happening, and that gives a better understanding. So it is equally important to illustrate, but don't keep on drawing for every scenario. So make sure you draw wherever you think it might be easier for you to explain the information. You can illustrate that. And finally, when you already had a 3-minute bell ringing, like the warning bell, nearing the end of your station, it is essential that you try and wrap up your station to give it a completion. There you can summarize about what you have spoken so far in the delivery of information and whatever you have spoken. And also here you can cover what would be the immediate next steps, okay, for that particular conversation. And then this is the place where you can say that you're also going to involve the senior involve your senior doctors or the other members of the team or multidisciplinary team. You can talk about that involvement and give leaflets for the conditions which are relevant. So NHS has leaflets almost for all the conditions. So you can offer leaflets in most of the diseases. And also it is important. So you talked about next steps, involved the team members. You're giving information leaflet for them to read later. And also it is essential that you signpost. For example, if it is a chronic condition like a leukemia, anorexia nervous, or any behavioral problems, and all those things where you know that they have a support group, you should also signpost them towards the support group. Or if it is a complaint scenario, you should also signpost them to PALS. PALS is basically patient liaison service, advice and liaison service, where basically whenever there is some medical error or if the patient is not happy with the management that is happening, they can, if your explanation is not adequate, they still want to raise a complaint or anything, you can always direct them towards Pulse. Okay, that is about template. So there, to quickly reiterate, so you go inside, you introduce yourself with the role, what is your role, and then you prepare for the interview, make sure you're talking to the right person, and no interruptions from your side, and also offer them to see if they want anybody else to attend. And then you go directly to introducing the task rather than beating around the bush so that you can have enough time. Introduce the task. Once you have introduced the task, you should know how much they know about that particular topic. That is checking the background. Ask them, you can invite them to interrupt if they have any understanding difficulty. And then you go on to deliver the information. If it is a huge amount of information, you can break them into chunks, give the chunk, check if they have understanding, and then move on to next chunk. Wherever needed, you can illustrate. Wherever essential, you can draw and illustrate to deliver this information. And finally, when 3 minutes bell rings, after some time, you should be in a position to summarize what has happened with your immediate next steps. So next steps is also essential. That carries 2 marks as well. And here you can say who you're going to involve, give them some leaflets, and finally signpost them. Okay, with that, I think I will stop about the introduction for communication scenarios. We can do two information giving scenarios. Has anybody volunteered? Okay, let me check. Okay, okay, so
Yes, ma'am.
Dr. Zaman and Dr. Mala. So first, Dr. Zaman, are you ready?
Yes, ma'am.
Okay, I'll show you a scenario. As in exams, I will give you 4 minutes time to read through this background information, and after 4 minutes, we can start the scenario. Okay, can you see the screen?
Yes, ma'am.
Okay.
Hello, ma'am. Can we start?
Hi, are you ready?
Yeah.
Yeah, okay. You can start.
Hello. Good afternoon. I am Dr. Jaman, one of the choice doctor here. Am I talking to Mrs. Mom of 3 years old girl Lily?
Yes, doctor, that's right.
Thanks for coming here today. Do you want to anybody else join with our conversation, please?
No, doctor, it's only me available here today.
Okay. Thanks a lot. How have you been updated about Lily's condition so far?
Yeah, they did say quite a lot about this is all completely new. We are completely flabbergasted as well. Yeah, they've said she has diabetes and we are following the treatment for the same.
Okay. That's great. I am here to talk to you about the diabetes. and it is called the Lily suffering from insulin dependent diabetes. Are you following me?
Yes, yes, doctor.
Yeah, I have draw a picture for you, and this is our pancreas, an organ we call it pancreas. Are you following me?
Yes, doctor. Yeah.
And this organ in our tummy is very important because this organ secretes a lot of substance. One of the chemical substance is insulin. Are you clear
Okay.
so far?
Yeah, yeah, doctor.
Yeah. And we know that this insulin is very much important for our sugar, blood sugar, that is glucose control. And I have drawn a flowchart for easy understanding that the insulin helps the sugar go through the cell of our body. That is the smallest building part of our body. Am I clear so far?
Yeah, doctor.
And as the lily has little insulin in her blood, so what happened? So as a result, the glucose cannot be entered into the cell. As a result, glucose becomes very high after meal. And as a result, the complications such as very high level of glucose in the blood as well as the blood level of sugar is very high, so some sugar splits into the urine, that is we call in p, comes in the p, and as the sugar comes to the p, so sometimes bug grow in the p. Yeah, are you with me?
Yeah, yeah, doctor. But why did this even happen to Lily in the first place?
Okay, no,
Yeah,
no, no, take it down. Take it over. Come on.
yeah. You are a very interested mom, and thanks for a very good question. Yes, there are many ways.
Anh mà đi phòng ngủ.
I'm going to mute everyone. Can you unmute yourself, Susman?
Okay,
Yeah, thank
there
you.
are
Sorry.
yeah, there are many kinds of things for which the insulin became decreased in the pancreas, such as maybe bug. Sometimes bug attack the gland and destroy the gland, so insulin production is decreased. Sometimes in our own body has immunity, that is the recognizing a outside foreign particle and destroying that is called the immunity system. Sometimes this immunity system became very much activated, and this immunity system cannot differentiate its own organ. Sometimes this immunity becomes hyperactive and destroys the sports organ, that is the our gland pancreas. So maybe this is called autoimmune disease, autoimmune destruction. Maybe bug, autoimmune, sometimes idiopathic. The cause we don't know actually what happened to Lily. But we have come to know that the insulin is very much decreased in Lily's pancreas. For that reason, we have to give him insulin from outside. Am I clear so far?
Yeah, doctor.
So, there is another kind of diabetes that is called the type 2 diabetes, that is also called diabetes mellitus. In that region, what happened? The insulin is not destroyed, but the insulin quality altered, and where insulin act in the
6 minutes
cell.
up.
Okay, that is also sometimes altered. So we have to give them medications from outside to help the insulin act uh, accurately. It is called type 2 or diabetes mellitus. But there is condition is type 1, that is insulin dependent diabetes. So we have to give insulin from outside. So have you any other concern so far?
No, doctor, not really. So, well, so could you explain about what exactly happens when Lily's insulin is low?
Yeah. When Lily's insulin is low, the blood sugar will be very much high. As a result, it may so much high that in P the sugar comes, and not only P, as the sugar cannot work properly, so the cell will work in another way, and toxic substance, that is ketone body chemical substance, will be happen in our body. So if we don't give insulin from outside, the blood sugar will be very high. The bug infection bug will be grow in the blood, in the pee, and also the eye, one important structure, retina, will be destroyed, and our body, due to lack of insulin, so due to lack of blood sugar, as the glucose or blood sugar cannot enter the cells cannot act properly, and different cells in different organs will be destroyed gradually. Are you
Okay.
following me?
Yeah, yeah, doctor.
Uh, have you any other concern, or I will go through a
Uh,
concise?
no, doctor.
Okay. Then uh, today I discussed with Mrs. Hawk, mom of 3 years old child Lily, who has been diagnosed as insulin dependent diabetes, and we talked how insulin lack of insulin causes diabetes, and what happens if we don't give the insulin from the outside to the body. And uh, here is the important leaflets. Here is shown what happened in insulin dependent diabetes, and here also the important websites. You can go also through the important website for easy understanding of pathophysiology of diabetes insipidus. And I also attach to the some groups of same kind of people
9 minutes up.
who are suffering from the insulin dependent diabetes. So, okay, thank you so much for giving me a lot of time. Thank you.
Thank you, doctor. Oh, well done. Okay. So, first of all, thank you for attempting. That's very courageous of you. You did well. How did you feel the station went?
Uh,
How can
I
I
think,
address you,
yeah,
doctor? Is this Susman
yeah,
or
yeah. I full name is Dr. A.S.M. Shamsud so I
uh,
give a little name for Dr. Jaman.
Zaman? Zaman. Okay, fine. Yeah, Zaman. Okay. Yes, go ahead. How did you feel the station went?
Yeah, the station goes very smoothly because you don't interrupt me, don't ask any other too much questions.
Okay. Okay. So you felt it went, the flow was okay and the station was smooth.
Yeah,
Okay, okay, perfect. So any other concerns you had with the station? So you don't have to expect that the role player is always violent or always angry. Sometimes here you're going to talk about pathophysiology, and you can expect Lily's mom, unless and until she is a medic, she's not going to understand what this pathophysiology is. So they will be sometimes in a position of getting, that is what information giving is, in a position to try and listen and understand whatever you try to say about this pathophysiology, because that is a completely new topic. But they will have lots of doubts. If there are many jargons, they might not understand as well. Okay. So that is why the role player is silent, trying to listen, trying to understand to what you're saying. Okay.
yeah.
Any other questions you had with the station?
I have no question, but should I talk about the also type 2? Because there
No.
are two types of diabetes. I am a little much confused about it, but
Yeah,
so
but
I
I,
also
I
talk
I will
about
give
it.
the feedback about what you did, what you can do better, because this is the first time you're attempting, and also I'm not sure how far with your preparation you are at the moment, or whether you have a slot for the exam. So
Yes,
depending
I have
on,
a slot for the exam in Sri Lanka.
so when is your exam?
Yeah, 27th March.
Oh,
1 month
next month.
left behind.
Okay,
Only
okay.
1 month.
Okay, all the best. Okay. Okay, so probably that is why you have prepared. So then I can give you certain tips and tricks because you're nearing to your exams. You can change few uh, maybe some styles you can change, and
Yeah, yeah,
certain
sure,
ways
sure.
you can try to modify the station so that it will sound even better. Okay.
Yeah, yeah,
I will
sure.
wait. I will give you the feedback, but I'll wait to see if anybody from the audience had any doubts or any appreciations or anything that he could have done differently or could have done better. Any suggestions? Okay, probably everybody is silent, so no problem. So I will be letting you know. So what happened in this station as an examiner, what I have listened and what can be made a bit better. Okay.
Ma'am, it
Uh,
can
Yeah.
yes.
ma'am,
Yes,
it can
please.
be told like insulin is like a key, and without the help of this key, it is difficult to make the blood sugar enter the cells. And without the blood sugar, without the sugar entry in the cell, uh, it is like starving cells, and also the blood sugar remains high. Although he told the same thing,
Yeah, in
maybe
his
some
own
easier,
language. Yeah,
yeah,
yeah. So
easier analogy can be used. Yeah.
yeah, you can always compare it with something to make things understand better. So that is also a way to communicate, but you can pick and choose your own style. As far as it is simple and understandable, the examiners will be happy. So there is a hands up. Yes, go ahead, Verda.
No, well done. He attempted very well. I just wanted to add one point that I guess we have to explain to mother that why it's necessary to for them to understand the pathophysiology or mechanism behind, because the main concern of attendants will always be why they will need insulin for the whole life. They need to understand that she will be needing insulin for her whole life, and understanding this pathophysiology will help her understand that why she is going to need it for the whole life.
Yeah, exactly. That is the whole point behind this scenario, because you have quite a lot in the background saying that this child has already been diagnosed as under follow-up. Everything is there, but still they need to know about the pathophysiology basically to understand about what you said. So that is an important point to emphasize so that they understand, and also they will be compliant with their treatment. Yes. Thank you,
Yes,
Verda. Yes, yes.
thank
There
you.
are few sentences like somebody mom should be engaged. Yeah, communication should always be bi-directional. I think he tried to engage by asking you, "Are you following me?" And all those things. Yeah, mom should. In communication, you do expect a two-way communication. Should have been asked about their knowledge. So that is the importance about following the template. So yeah, you can always ask them, "How much do you know about this diabetes?" I think he did ask about it. Uh, but in a different way. Use of long sentences. So this is not only for Dr. Zaman, but for everybody. Try to avoid a longer sentences and also too many sentences in a row without giving a pause. So don't talk more than one or two information. Pause it, make sure they understand, and then move forward. Okay. So those were some of the chat queries. Okay. So coming back to Dr. Zaman, so yeah, as said earlier, bravo, you had attempted the station well. You were able to finish the station within 9 minutes. That's a good way of doing a station. Um, a few things that you can try to make it better
Yeah,
is that
sure.
when you said you, I think you should introduce the topic. I can say that here, I am here to talk to you about the pathophysiology of what is happening inside lilies, and for you to understand what exactly this type 1 diabetes is, or insulin dependent diabetes is. Okay, so and then you asked about how much have you been updated about Lily. I think exactly that is what you asked me, and I said like I'm quite flabbergasted. There is too much of information, too much is going around. Then you can take a pause because the mom feels she is quite exhausted, or she has so many things to do because this is completely a new diagnosis. She has been recently admitted. So, in all such cases, you should ask about the well being of the child, well being of the patient. Like you can ask, how is Lily doing now? Because she was recently
Okay.
admitted. Probably it is a DK. A quick question on how is she doing now? She may say she's doing much better, doctor. So, that is kind of building a rapport, and then say that you are here to talk about the pathophysiology. You did illustrate, so good. Hopefully, you had illustrated in your paper. I could not see anything here, but you had some illustrations there. Good, you can do that. When the mother says it is a lot of things going around with Lily because it is a new diagnosis, you can take a moment, pause, and say, yes, I can see that the whole diagnosis must have been a shock to you and difficult to understand as well. We are here to help you as much as possible. Be assured that we are here. We are all here with you. So when they say something like they are overwhelmed or anything, you acknowledge it. That is called emotional acknowledgement, and then you move forward. It doesn't have to be long sentences. You can say that, yeah, that must have been a shock, or that must have been a quite difficult. But I can see that you're doing very well because the background says that she's been discharged on subcutaneous insulin and she is doing well. She's attending regularly all the teams, and and she's managing very well. That is what the background information says. So that is where it becomes important for you to understand the background information and use that information here wisely, saying that, yeah, I can see from the records that you're managing very, very well. You're doing a great job. So that is like addressing the emotional concerns and also encouraging them. So that is what is essential in communication. Okay.
Okay,
And
ma'am.
I think you can avoid long sentences. And also, I felt it was quite monotonous because for everything you said, are you following me? Are you following me? Are you following me? So try to use different things. Like sometimes when you're talking directly face to face, sometimes even a head shake or a non-verbal cues you can use. Sometimes you can say, are you following you or following me? Are you with me? Are we in the same page? Do you understand? So use many different types of phrases rather than saying, as I said, like don't keep on saying I'm sorry, sorry, sorry. Are you with me? Are you with me? Are you with me? No. So use different phrases that will give a better uh, so to the listener it will sound even better. Okay.
Okay,
And at
ma'am.
the end of this information giving, this is too much of information that you're giving. You can always say, I understand that a lot of information has been given to you in such a short time. It might be difficult for you to understand. I can, anyways, offer you certain leaflets. So say that. And if you, at any point, if you feel you don't understand something, always get back to us. We will be happy to explain you once again as and when needed. Okay. When you give too much information, you can say here the unnecessary part was type 2 diabetes mellitus. You didn't have to say about type 2 diabetes mellitus. That will kill your time. So you don't have to talk about type 2 diabetes mellitus. But what you should do is first start saying that Lily, we have diagnosed that she has insulin dependent diabetes mellitus. What is it? It is a type 1 diabetes mellitus. And you should also, you're asked to explain the pathophysiology. So you should say that it is an autoimmune disease. Explain what is autoimmune. Basically, your own immune system are fighting against your own body cells. And in this case, as you said, like you had already drawn the pancreas, you can say the cells in the pancreas are getting affected, which usually secrete insulin. So the insulin, do you understand?
Yeah,
So
ma'am. I am
start
with
with
you.
that. So start with what, why is this disease. Yeah, like it is a autoimmune disease. So once you say that, then you talk about the role of insulin. What does insulin do in liver, muscle, adipose tissue, and what would be the complication when the child has type 1 diabetes mellitus, especially diabetic ketoacidosis and all those things. And you said like some of the organs, they might get damaged in a long run. So you can also mention about the uh, uh, organs, like the kidneys might be affected, the eyes and nerves might get affected as they progress with this condition for a longer time. However, we are going to monitor for all those complications closely. That is why it is essential that uh, compliance with the treatment is essential, as well as a regular follow-up is very important. So you say the pathophysiology, so they understand the link between why they'll have to what they'll have to do. Okay. Otherwise, I think you told everything that we had in template, checking the background, illustrating, summarizing. You tried to do all those things, and also there can be some ups and downs in your tone if possible, because I totally agree that English is not our first language. It comes to many of us with difficulty. However, try to practice different types of sentences. Okay. Those are some of the
Okay.
suggestions from me to you. Otherwise, you did well, Zaman. Thank you so much.
Thank you, ma'am. Thank
Thank
you
you.
so much for giving me.
My pleasure. My pleasure. Okay. So, is it Dr. Mala who wanted to do the second scenario?
Yes, ma'am.
Okay, perfect. So again, this is going to be an information giving. So today's topic is only information giving. So there, can you see the scenario? Not yet.
No, ma'am.
Okay. This is another simple station. So similar to type 1 diabetes mellitus. Can you see?
Yes, ma'am. Now.
Okay. I'll give you 4 minutes time and then we'll start.
Okay, ma'am.
Are you ready?
Ma'am, what is the name of the mother? Something is not written.
Was the name not there in the information leaflet? She is Mrs. Sarah.
Mrs. Sarah.
Yeah.
Okay. Okay, ma'am.
Yeah, you can start. Your time starts.
Okay. Hello, I'm Dr. Mala, one of the doctor working in this hospital. I believe I'm talking to the Mrs. Sarah.
Yes, doctor, you're right. Hello.
So nice to meet you. And first of all, congratulations on the birth of cute baby.
Thank you so much, doctor.
Actually, I am here, Mrs. Sarah, to discuss some issue regarding your baby. But is it suitable time for you?
Yeah, of course. Yes, doctor.
Okay, good. And Mrs. Sarah, would you like anyone to be here, or shall we start?
Yeah, it's only me here, so yeah, you can start.
So, Mrs. Sarah, can you tell me, what do you know about your baby's condition?
Is there something wrong, doctor, with my baby?
Okay, Mrs. Sarah, do not need to worry. I will tell you everything in step by step. So, when we notice your baby and we the test, the on the blood spot test that we call the newborn screening test, and the some like the thyroid hormone, that is a gland that is present in our neck, and that the concentration of this is like more than 200. Are you getting my point, Mrs. Sarah?
Uh, no, not really, doctor. So, did you mean to say something is wrong with my baby?
Yeah, Mrs. Sarah, unfortunately, I have to tell this thing, but when baby's born, so what we do some taste like on the newborn, like we take a sample from the heel that we call the heel prick testing, and they test like many disorders. So on the basis of this, like when we taste the thyroid stimulating hormone, that is so I can tell you everything what is the thyroid. Okay, so can you follow me at this diagram? So this is a neck. This is our neck. I'm pointing towards my neck, in which the gland is there. That is called thyroid gland. And what did it secretes the hormone that is called thyroxine.
Okay.
Yeah, but in this case, like the secretion of thyroid hormone is like less, means the hormones in the least concentrations are present in your baby, this cute baby. But Mrs. Sarah, that is not problematic. I tell you, like I will reassure you that this will come, and we will taste for the further as well. We repeat this test.
Okay. Okay.
And can you tell me the what are the functions of this thyroid, like the gland or hormone?
I have no idea, doctor. I'm just shocked that something is wrong with my baby already.
I'm really sorry, Mrs. Sarah, for that. And would you like some cup of water?
No, I'm all right.
Okay, so Mrs. Sarah, the functions of thyroid hormones is that is it is essential for the brain development. It is also for the growth of the body and energy regulations.
Okay,
And
so is my baby going to be deficient in her growth and development?
You are the partially right, Mrs. Sarah, but I am again saying like when we do the repeat test, like this test after the some time, maybe it is that is also transient one. There are two types. Like now it is diagnosed on the that time, so it is called congenital hypothyroidism. And when it is covered, like the when we test after 3 years, we will see if we stop the medication, and we will see it is a transient or the congenital or the persistent hypothyroidism.
Okay.
So, Mrs. Sarah, like we first of all we will like the measures each things like the respiratory rate, vitals, like the saturations and pulse as well. After that, we will give him some medications as well if it is not controlled. Like we will check the hypothyroidism symptoms, like the pretty means the patient goes in a decreased respiratory rate, or we can say decreased heart rate. After that, like we start the another test, we will read the test sample. After that, we will start the medication.
Okay. Is my baby going to be all right?
Yeah, Mrs. Sarah, many people, many babies have this condition, and he will get better from this condition. But some babies have potential. But I will try to assure you that
Your
the
voice
many
is breaking,
patients
doctor.
had the condition. Okay.
Okay, doctor.
So, Mrs. Sarah, I'm saying like yeah. And Mrs.
Yeah,
Sarah,
continue,
we are
continue.
lucky that we discovered this on the time. If we if we like the delay that thing, or we not did the conditions on time, then this will affect the brain development. But we have luckily diagnosed on the time, so we will prevent this condition.
Okay,
Are you
okay.
with
So
me, Mrs.
yeah, you
Yeah.
mean to say if this is completely preventable then?
Yeah, by giving these medications and but I already told you, like the many patients have the recovery from this condition, but it depends upon the potential of the baby as well. I can't tell you like in the reality like that it will becomes like
6 minutes left.
yeah, that it will becomes really totally fine. So I will not make you in a doubt.
Okay, doctor.
So any other concerns that is bothering you?
No, I just wanted to make sure that my baby is going to be all right or anything that I need to do for her.
No, Mrs. Sarah. I really appreciate you that you are the keen mom of the baby, but I am. We are working as a team, and we are with you as well. We will like treat this condition on the time, and I will know that you will give the medication on time. And on the basis of this, the compliance, the baby will become grow in a fine way. Not the growth is affected or any other thing.
Okay, okay,
Are
doctor.
we on the same page? Okay.
Yeah, doctor.
So So let us summarize what we have discussed today. So we have discussed about your baby's condition date on the newborn screening test, that the level test that is more than the 200 that is suggested for the congenital hypothyroidism, and we have told what happens in the future if we do not treat this on the time, and we will treat this this condition. So if I will also give you some leaflets website, and I will also attach to the parents that the children have the same condition. And if you feel any query, Mrs. Sarah, we can arrange a meeting with a consultant as well, and you can contact us without any hesitation.
Okay, doctor.
Thank you, Mrs. Sarah, for your time.
Thank you so much, doctor. Have you done?
Yeah.
Okay, 7 minutes, 45 seconds.
Oh,
Yeah. So sometimes this is what happens even during our exam. So there is a knock at 6 minutes and then we rush. So try to time yourself and don't you use your time wisely because at the end you had that you wanted to rush, isn't it? Because you wanted to summarize. So yeah, we'll have to control that now. So otherwise, it did well. How did you feel the station went, doctor?
you are the senior one and you are judging me, then you will tell me in a fine way.
Yeah, sure. I'll do. So, how did you feel the station went? Was there something that you could have done better or something you will do differently when you do
Yeah,
the next time?
I have to add the something in between the like the tell the mother everything about this. But I say maybe the layman mother is a layman, so he can't she can't understand everything. So I tell this in a simple way. Can't go in a deep in a long discussion. But I am asking from the mother any concerns, and in the
Yeah,
end, after like 6 minutes, but mother says no any concern. So why I repeat the same words for that reason? I said I'm not bothering you, so in the end I will offer you. And the mother I have to offer you like we consult arrange a meeting with the consultant, and if you have any query, you can discuss this in a meeting.
yeah. So those are all part of like your summary, like you involve the other senior members, your teams ask well. Those are all good points that you'll have to do when you introduce a new topic. Okay. Well done. So let's see if
Thank you.
anybody from the audience have any questions or anything that she might do better or anything she did very well.
Yes, ma'am.
Anybody? Any suggestions? Yes, Verda.
Um, Actually, did really well. But the one point that TSH was more than 200, and then when it's more than 200, there's no doubt about the congenital hypothyroidism. So I guess the explaining about transient and it was not needed. We have to start thyroxine anyway.
Okay,
When
you
it's
feel
more,
so. Okay.
so this is like we can say wrong information. Like,
Okay,
uh,
so yeah, so no harm in her telling transient causes is what I feel. That is okay. So so the blood spot is just a screening test. If the TSH is more than 200, you would expect that the child could have congenital hypothyroidism. But about the causes, you will still not be able to confirm unless and until you do a postnatal evaluation, isn't it? Even after, so with this information which is given, so this is a blood spot test. You will have to send further testing for this child, the bloods as well as the scan they will do and start them on medication. But however, there is no harm in telling what are the causes of congenital hypothyroidism. That is how the station will go, isn't it?
Okay, but I just thought that they still there were no doubts actually. I guess because it's written that if TSH is more than 20, it's almost confirmed that there is congenital hypothyroidism. Yes, you sent further three,
Yes,
four, and the
yes.
thyroglobulin to further confirm it.
Yes, yes. So that is exactly what she is trying to say. So here you will slowly start and introduce saying that the child has congenital hypothyroidism. So there is no doubt about congenital hypothyroidism, but still you're not sure about what is causing the congenital hypothyroidism.
Okay, okay.
Okay.
Thank you.
Thank
Thank
you
you.
so much, Varda.
No
Good question.
worries.
Anybody else?
So, ma'am, I have two questions. Will
Yes.
we involve the gland doctor here or not?
So
Another
eventually you will involve the gland doctor. So in summary, you can say that we will be doing. So that would be your immediate next steps, isn't it? You'll be doing further blood testing, and the child will need special scan to know about the thyroid gland itself, its structure, where exactly it is located, and all those things. And once it is diagnosed and confirmed, the child will also need specialist doctors. The gland doctors who are called the endocrinologists, they will also be involved. Yeah, that is the way you say.
okay, ma'am. As the TSS is very high, should we, as it is screening test, that is the hill peak test, should I recommend a further blood test or not?
Yes, yes, of course. Of course, they will definitely send the blood test before starting any thyroxine. They will
Yes.
definitely send 100%, they will send the blood test.
Okay,
Another
ma'am. Thank
question,
you.
Dr. Geetmala.
Yeah.
I would like to ask that should we take it as a breaking bad news? Like while the congenital hypothyroidism has an excellent prognosis, if it's treated it has an excellent prognosis if it's treated just
Yes. So
in
that's
introduction,
a
just like so say that
very
we
good
have to.
question.
Okay, I believe I'm like I'm afraid that I don't have a very good news for you. Should we start it like
No,
that?
no, no, please don't. So she started very well, I would say. I like the way like she took it like congratulated the mom. A good thing to do whenever you see somebody pregnant or the mother who has recently given birth, congratulate. That is the way. So this is not breaking bad news, but it could be a bad news to the role player, isn't it? You're not breaking the bad news. Okay, you can say so,
Okay.
so only thing is the way you introduce the disease matters. So if you say the child, everybody has a gland in front of the neck, it is called thyroid. That is a thyroid hormone which is essential for growth and development, and that hormone is very less. So immediately what comes to, as a mother, what would you think that my child's growth and development is going to be affected, and that is the prime part of their upbringing, isn't it? So the way you introduce the topic
Yes, yes.
is something that will change the whole mood of the scenario. So here what you'll have to understand is this is a screening test. And why is it screened? You'll have to tell them why is it exactly necessary. For example, in this station, if it was me, I would say like initially. So Dr. Mala initially started with too many sentences, giving all the information at a time, and then saying congenital hypothyroidism. And then I told like I'm completely blank. I didn't get anything. Is my child going to be all right? Do you understand? So you
Yes.
can't give so many information. So then you corrected yourself, saying that in the newborn, we do blood spot test. And this test is basically to screen for many diseases which can be detected very early and treated. One of such problem is a thyroid problem. So in this blood spot test, we found that this hormone is abnormal. And then
Yes,
you
ma'am.
say what it
Oh,
is and what does it mean. So then you talk about like this is a gland in front of the neck, this is the function, and when this hormone is deranged in this level, we think that the child might have congenital hypothyroidism. And as you said, like that is a decrease in the hormone. But this is breaking bad news for the mother, because you had mentioned that this hormone is going to help the child for growth and development. Now the child is not going to grow and develop, because that is where we stop the communication. But you'll have to reassure here, saying that exactly that is the whole reason why we are doing such an early testing. As soon as the baby is born, we are doing this testing so that we can detect the condition even before any signs and symptoms appear, and we will be able to treat it. If the treatment is taken fully, the child will be able to live a completely normal life, isn't it, with normal growth and development. So that is something you'll have to reassure the mother.
Yes, ma'am.
Okay,
okay,
so you
okay,
say that
fine,
the
fine.
child has not got any signs and symptoms so far. This is a screening test. When the baby, so she can still ask. If I would have even asked, like, the baby was in my womb for 10 months, so the baby didn't have this hormone. Uh, how does will my baby be affected in terms of growth and development? Then you should always try and reassure, saying that when the baby is in the womb, your hormone is going to take care for the baby's growth and development. When the baby is born, that is when they will have to function on their own and they need this hormone. However, because this is detected early, there is very good treatment where we will be able to completely replace the hormone needed for your baby from outside. And then you should also say that this is going to be a lifelong treatment. Then you can talk about all those things that you talk. Causes can be either temporary or permanent, depending on those. And that is why we are going to now send more blood test, and also we need to scan the thyroid. So those are your next steps, isn't it? Your next steps are blood test, scan, and then starting on treatment. So that is something that you will have to introduce. And then, even though this is not a bad news, you should reassure, saying that the baby will be completely normal if given treatment. However, it is important that you focus on saying that why it is important to be compliant. Here you should say complications, saying that if you take medications regularly, the child will have a complete normal growth and development. However, in some cases, when people miss these medication or something, then the symptoms will develop, because this hormone is very essential for day-to-day living. And in newborn, it will manifest like feeding difficulty. They become very sleepy, lethargy, constipation, jaundice. And as they grow as an adult, they will have this mental development, learning, and clumsiness. So all these we will say so that they are compliant, but you don't scare them. Do you understand the difference?
Yes, ma'am.
Okay,
I
perfect. So
understand.
if you can do it in step by step, saying like this is blood spot test, thyroid problem, what does it mean to you? What can be done? Is it something to be worried? So if you can split that into it, and then it would be an easy stage. You
Yeah, first of all, I have to mention that, like, yeah,
yeah,
first of all, I
for
have to mention like newborn screening test, what is it is, etc. After that, we have to tell about the
yeah.
pathogenesis of thyroid. Yeah.
Yes, yes, yes. So otherwise, whatever you did, I wouldn't say like it was wrong or right, but the structure can be a bit different.
Correct.
I appreciate you for congratulations. That is a good gesture. Reassurance is very important. And when you hear the 6 minutes bell, don't rush. You still have 3 minutes. That is half of the time of what you did in the first 6 minutes, isn't it? So when you practice, make sure you understand the timing as you talk. You will understand how many sentences you will be able to accommodate in the last 3 minutes. Yeah, and also only one thing is, Dr. Mala, there was some problem with understanding she and he, because I was telling the baby as she and you kept on telling he. Don't do that as well. Don't change the gender of the baby. That wouldn't put a good impact on you, a good impression from the examiner. Okay.
Yes, ma'am.
Okay, so because I kept on saying she and you kept on saying he, so listen carefully or read the scenario, and also asking mom's name. The scenario is given and the task is talk to mom, Mrs. Sarah. So you should be very vigilant on what is given in the back information leaflet. That is the reason why initially I said make a note of the name in the paper when you enter, so that you don't forget. Even if you forget, you can just quickly peep into it and then talk about it. Okay. And one,
No mother
yes,
name is
yes.
mentioned. For that reason, I am asking.
Pardon me?
In this page, no mother name was mentioned. So for
Oh,
that reason, I have
okay.
said
Let me
what
show
is the
you the case again.
okay, okay, yeah, yeah, please.
There's only 3 lines in this candidate information leaflet.
Oh, yeah,
Yeah.
yeah, yeah. In the task, it is
Yes.
written. Yes,
Can
yes.
you
Yeah,
see? Yeah, this is Dr.
yes,
Mrs.
ma'am.
Sarah. Yeah, that is why I doubtedly asked you again. But no problem. You can make any amount of mistakes here. As far as you don't repeat it in the exams, it's all fine. Even if you forget, you can ask them, how can I address you? So that is a polite way.
Yes, ma'am.
Yeah. Okay. And also one kind suggestions to everybody who is going for exams, like we will not have enough time to finish. So what you can do is don't go deep into the knowledge dive. So communication is about the way you communicate. You should try to cover as much as possible the important topics, but don't go very deep into the pathophysiology, too deep. So this could be transient. Is this DSH more than two? No, that is not the scenario. The scenario for you is to say that there is something wrong with the blood spot test, and it says that the thyroid can be affected. So you're going to do further blood test, do scan, and then reassure mother. So that would be the basics. If you dive deep into the medical knowledge in communication, sometimes you yourself will be uncertain about what to say. In that situation, it will be very transparent that you are not clear with your ideas, so that will put down your mark. So some people who do it little superficially but trying to touch important topics, they will get good marks rather than people who are talking high-fi more in deep depth about the medical knowledge. So always take care of that as well. So adapt your situation accordingly. Okay, there are lots of
So,
questions in
madam,
there. Yeah.
so according to you, like the screening,
Just a second, Rubaisha. Somebody has
okay.
been raising their hands for quite a while. Is it Ayman?
Yes, ma'am.
Yes,
I,
yes.
I had one doubt.
Yeah.
So the task of this today, this communication scenario, was mainly to explain about the diagnosis and further steps. So
Yes.
my doubt was we have already explained and already discussed in length about congenital hyperthyroidism, and that was good. So in regarding further steps, we also have you have mentioned that we have to discuss about the blood test and the scans and everything. So my doubt was whether we should mention that the baby needs levothyroxine for lifelong, and they'll have to come back for follow-ups for like initially follow-up. Should we have
Yes,
to
yes.
mention that
That
in detail?
you will have to mention that. So detail, I don't understand. So you don't have to go into great details like you're going to start with 15 microgram per kg. No, you will have
Okay.
to, but you should say that this child immediately, anyways, because this is a screening test, we are going to do further blood tests to confirm what exactly is causing this condition. Okay, we will run a few blood tests related to the thyroid gland, and also to check for what is causing this. And then you should also say that we are going to do a special scan. Usually they do a nuclear scan, isn't it?
Yeah.
So we will do a special scan as well to see, and it will tell us what the other causes as well could affect the thyroid. So that will be your next step, including, and also the baby will need hormone replacement.
Yes, and we have to follow it up with tests after once we start treatment, and
Yes.
we can
So
confirm it we have to send further blood tests which will confirm this. We'll be starting treatment meanwhile, and then if it is confirmed, we'll be following the baby up with further blood tests.
Yes, once the baby is started on treatment, we will initially baby will need regular blood tests to work out on the right dose.
Yes.
Okay, and depending on the cause, if the baby has some permanent cause, it is the baby will need the treatment for lifelong. So all those questions will sometimes come from the parent itself. Is how
Okay.
long should we take the treatment? So that is what they will be interested in, isn't it? What are the side effects, what can happen, and all those things. So when they ask, you will have to definitely talk about it. Otherwise, you should say the child will need hormone replacement. Initially there will be close follow-up to work out on the dose, and depending upon the cause, if it is a permanent cause, the child will need a lifelong treatment. So you can stop there rather than going too much into details.
Okay, and I had one more doubt. Should we
Yeah.
mention that they'll be needing an appointment with a gland specialist doctor, that is endocrinologist,
So
or
we
should we?
you can say that eventually you endocrinologist will be involved. Yes,
Okay, so that once we get to know further about the tests, then we might need to involve. So should we mention that, or is it not really
you
needed?
can mention because you want a specialist to reassure mother when she asks. You can say that once we find out the cause, do the basic investigation. We will also be in touch with the specialist, hormone specialist, to
Yes.
make sure the right thing is done, or is there anything else that needs to be done. So in UK, as against other Asian countries or anything, in UK it is more like a teamwork. They involve every specialty possible in a child. So there is no harm in saying that you're going to involve the endocrine specialist.
And I would
Yep.
like to add one more thing, that I think we can also mention that apart of we are doing tests for baby, we also have to do test for mother for free T for TSS. So I think we can add that also.
Yeah, if you wish to. So this is something what I would say, like, don't go into too much
Very deep.
details.
Okay.
Yeah, don't go into too much detail. So why do you want to do testing in mother?
That's given in like
Autoimmune.
guidelines basically, whether it is
Yeah, yeah,
there in mother up and then also in the baby.
yeah. So, but do you think they would not have tested thyroid for mother during antenatal visits in UK?
Yes, they would have tested.
Yeah, yeah. So sometimes stick to the task. What you said is not wrong, but they invariably do test for mothers when they are when they are in the antenatal period. Okay.
Oh, thank you.
Yeah. You can say that we will also look into your records to see thyroid has been tested. So if you have some information, some valid information from the guidelines, you can use it, but formulate in a way that it is relevant to the patient.
Okay,
Okay,
thank you.
perfect. Thank you so much. Anybody else? One more hand. Who's okay? Somebody else was talking while I interrupted. I'm so
Yes,
sorry.
ma'am.
Yeah, yes,
No,
yes.
no,
Go.
it's okay. I'm Dr. Vaisha. Yes, ma'am. I was asking, like as you said, for me, the take-home message was just for the screening test. We should not it's not a breaking a bad news. Am I right?
Yes, for this case, for this scenario, congenital hypothyroidism.
And
This
rest
is
of the
not
other cases, like it is a phenylketonuria, like it is a bad news, maybe for me, phenylketonuria or something like
so
that.
the conditions which can be completely treated without any complications. So, congenital hypothyroidism, if the child is going to be on hormonal supplements, there is a way that the child is going to be completely normal, isn't it?
Yeah,
So that here
let
you
yeah.
you will have to do more and more reassurance. Anything
Mm-hmm.
anything to the baby is going to be a tearful situation for parents. Just
Mm-hmm.
you say anything like even TTN is very emotional for the parents because that is the scenario. However, the thing is how far you can reassure. For example, in
Yeah.
this condition, because it is treatable, you should be in a position to reassure
Yeah.
rather than
But ma'am,
scaring the.
what if we like for any actually made a template for every disease which is like not have a in this case it is a good prognosis, but we actually need to say that it is a like I'm very sorry to tell you like that screening tests are not fine, but in the other sections you make sure about you reassure the parents that it will be fine with the treatments. And is it also okay or not? Just in congenital hypothyroidism, it's not, as you said, it is not bad news actually.
So, what I understand from your question is that you want to introduce saying that there is something wrong with the blood
Yeah.
spot test. Yes, you can do that. That is
Okay.
exact
Okay.
information, isn't it? You're going to say that
Mm-hmm.
blood spot test was done. However, there
Mm-hmm.
are some problem with this blood spot test, and you're here to talk about that. You have
Mm-hmm.
found some problem, and then you talk about this and reassure saying that this can be fully
With
treatable,
treatment, it can be fine. Yes.
and the baby will be perfectly all right.
Okay.
However, you
Thank
should
you.
also stress on the complications so that they are compliant. Do you
Mm-hmm.
understand? So
Mm.
this
Yeah.
is
Yeah. Yeah.
completely treatable, but it requires compliance. You should suggest that as well. It could be
Mm-hmm.
normal only if taken medications regularly.
Okay. Okay. Thank you.
No problem. Thank you. Any further questions, or should we just call it a day? Okay. So thank you so much for listening. Hope it was at least useful for people who are starting to prepare. Uh, and there are few batches, like some of them are like more intensive batches where we don't give the time is quite limited, where people prepare only for 1 or 2 months. So we will do lots of and lots of mock, and that is how we learn. But there are some batches which are quite slow, like for 6 months or so, where we might learn in depth about, there is some teaching and then practice as well. So it depends on what type of uh, s- uh, a group you join. However, I hope it was useful. The template is the same. You can use the same template, tweak in between, listen to as many mocks that is being done. So when you listen to others, you will be able to judge yourself, like which went well. Like some of them will do brilliantly well. So you can always inherit those sentences or the style. You can inherit from them and then become better. So rather than being yourself, here you should be open to learn more and more new things. Okay. Thank you so much, everyone. Good night. Have a great day.
Thank you, ma'am. Thank you.